fibular head, common peroneal nerve, peroneus longus, peroneus brevis, fibular shaft, lateral malleolus, peroneal tubercle, calcaneofibular ligament, anterior talofibular ligament, posterior talofibular ligament, peroneus tertius, tibial tuberosity, Gerdy's tubercle, anterior tibial shaft, anterior tibialis, extensor hallucis longus, extensor digitorum longus, extensor retinaculum, dome of the talus, sinus tarsi, medial malleolus, deltoid ligament, sustentaculum tali, tibialis posterior, flexor digitorum longus, flexor hallucis longus, gastroc, soleus complex, Achilles tendon, subcutaneous calcaneal bursa,
Right underneath the skin before the Achilles.
subtendinous calcaneal bursa,
And that's underneath the tendon.
calcaneus,
Right here.
woot,
Alright, so active range of motion. Can you point your toes to your knee? Great. Can you push on the pedal? Great. Now we're gonna do gonio. Alright, can you put your toes to your knee again? Perfect. This, we want it to be 20 degrees. Alright, and now can you put your toes to the ground? Great. And this is going to be 50 degrees. All right, now can you point your toes to the wall and out the other way? Perfect. So now we're going to do goniometer. All right, can you put your toes that way? Very good. This is going to be 20 degrees for inversion. And then can you put your toes out this way? And this is going to be 5 degrees. So next we're going to do passive, so planar flexion, dorsal flexion, inversion, and eversion. You can also do dorsal flexion, passive range of motion off the table. So would you like to demonstrate that? And then you just bring the foot up, and that's just to activate the soleus. So next we have manual muscle testing. Push up against my hand. Great, can you push down? Push to the side, now to the other side. Perfect. So now for the special test, you do this all bilaterally, everything. So the anterior drawer, like so, and that is testing laxity of the ATFL, which indicates a tear. So then you have the talar tilt, which is, this is inversion and eversion. Inversion is testing the CFL, the laxity, and if they have any pain, and eversion is the deltoid ligaments, which I also have pain and laxity if they're positive. Kliger's, I'm gonna dorsal flex and externally rotate, and that's checking for syndesmosis damage if it is positive. Next, we have the percussion bump test. You bump the bottom of the heel, and that is to check for any stress fractures in the tibia or fibula. Next, we have the POTS compression. Squeeze down the tibia shaft. If it is down more by the ankle area, that indicates syndesmosis damage. If it's more up here, it could be a stress fracture. Next, we have the Thompson's test. So I need you to roll over on your belly. So I'm just gonna squeeze her Achilles, or her gastroc, to see if your Achilles moves. If it does not move, then it indicates a ruptured Achilles tendon. So you can flip back over. Okay. And the next test we have, slide your leg off the table, please. This is Homan's. So you're gonna dorsal flex and extend the knee out. If they have pain anywhere on the back of the leg, it indicates deep vein thrombosis. You'll also be able to see like redness and feel warmth. So next we have the pulses. So tibial posterior pulse is going to be on this side, medial side of the ankle. And then the dorsal pedis pulse is going to be on the top of the foot, right there. All right, and then we have our myotomes and dermatomes. So I'll just hold your leg up for you. All right. L4 comes down to the big toe, and that is dorsal flexion of the foot. Next we have L5 that goes to the web of the first and second metatarsal. That is for toe extension. Very good. S1 comes down and inserts by the pinky toe. That is for plantar flexion. And S2 comes to the back of the heel, and that is for knee flexion. Neat. Very good. Next we have reflex. So relax your knee. All right, and then next we have the Achilles. Very good. And that is it.